not really knowing what to expect. We had the challenge from a medical standpoint, from a practice standpoint of, Ebola, something new to these shores, transmissible, highly lethal. And we had gone through certain prep steps and had to do some reflecting too, personally, as well as professionally, about how we would approach that situation. Were we equipped to deal with it? Fortunately, we didn't have to go down that path at that time. Last March was obviously a very different scenario. We had the situation where not only were we worried about it coming to the United States in Louisiana, but literally in our community. And knowing that this is a much more likely scenario than anything we've come across before. In my practice career, I've never come across something like a pandemic, obviously. Something that's highly communicable. So it gave me cause for pause, both from a professional standpoint and a personal standpoint. I took inventory of where my health and my head were at, and tried to figure out how that was impacting me personally, and also how it was impacting the crew that I work with, both my staff and the rest of the hospital, and the community in general. I reflected on what would I do if I got sick. Not knowing a whole lot about the disease and trying to figure out what to do about it, that's kind of bewildering at best. My wife and I had some very cogent discussions about, would you want to be resuscitated? Would you want to be intubated? And we both said, given what little we knew then, probably not. And as time has gone on, that decision has been reaffirmed. It's kind of poignant for me because on my birthday last year, Monday, March 16th was a day at 5 p.m. when things shut down in the state of Louisiana. So I was at work because I tend to like to work as opposed to just wallow in old age and self-pity. So being here and watching things unfold was kind of scary. And then knowing that we don't have all the answers and still don't have all the answers, these are just best guesses. What I was proud of, though, is the way overall we responded to the situation. We being us as a community, and specifically our hospital administration and the staff here at Rep. Time has given us the opportunity to go ahead and understand things a bit better. What we thought we knew, some of those things have changed in terms of how we treat patients. I was somewhat awestruck by the notion that we actually have a vaccine and timetable that we do. There's been nothing in the history of medicine that compares to that. I hope that, and my personal hope is that people will take this seriously. When they have the opportunity to get vaccinated, they do so. Because between that, hand hygiene, social distancing, and masking, we can get our economy back on track. I mean, those are things I miss, such as travel, hanging out with family and friends, and not being in fear of, am I going to get sick or am I going to transmit this to someone that I care about? Or even someone I don't know and care about. I don't want to pass this disease on to somebody else. I've seen patients that I've had the pleasure of knowing and caring for a number of years when I was in private practice die. I've had friends who've had their children die from this disease. I've had coworkers who've had family members become gravely ill. Some have survived, some have not. But the fear of possibly giving it to my 87-year-old mother, me giving it because of the environment I work in, or because she did something that was inappropriate, such as hanging out with friends, just because she's stir crazy, being 87 and pseudo locked up, and it's being a prisoner. Those sorts of things stick out. When you talk about a friend's son, a colleague's son, who fought for his life, but unfortunately didn't make it. It hits home.